I'm Dr. Lana Ruvvy, aka Dr. Ruvvy, and today we're going to be debunking some common myths in psychology. We've all heard them, whether it be on TikTok, in pop culture, or from a friend or a family member. But today, we're going to separate fact from fiction.
The first myth is we only use 10% of our brains.
Nope, that's not the case. Our brains are always working. However, some parts of our brains might be working at a lower or a higher capacity depending on what we're doing. Even when we're doing something that seems like it might demand the attention and resources of only one specific part of our brain, like say, looking at a friend, right? Which would engage our occipital lobes. There are so many other parts of the brain that work together to help us perceive our friend, recall our positive experiences together, and formulate the responses to whatever our friend is asking about.
All right, the second myth. If you are an introvert, you have social anxiety.
Perhaps some people who are introverted also have social anxiety. However, these two things don't always go hand in hand. Introversion is a trait, a component of your personality. People who are introverted might still love to go out, be in public, and spend time with friends and family and be social. However, they might just need a little bit more time to rest and recharge their social batteries. People with social anxiety disorder experience symptoms that are so distressing and impairing to their daily lives that they can't go out and enjoy those day-to-day activities of being with friends or family, being at work, or being in public spaces. Some of us might experience introversion or symptoms of social anxiety throughout our lifetime, but just because we do, it doesn't necessarily mean we're an introvert forever or we have a diagnosis of social anxiety disorder. We only receive that diagnosis when it becomes clinically impairing and distressing, prohibiting us from enjoying our daily lives. And fortunately, there is support that you can get if you are experiencing social anxiety. One of the most common forms of care for people who have social anxiety disorder is exposure-based cognitive behavioral therapy, where you can work with an expert clinician to practice being in social settings and learning skills that can help you feel at peace even when you're in what might seem to be a stressful situation.
Myth number 3. Therapy is only for crazy people and weak-minded people.
Oh, heck no. Therapy can be for anyone, and there are so many different types of therapy to meet the unique needs of each individual. Some people go to therapy because they are experiencing a mental health crisis or mental illness and need support. Others go to therapy just to learn everyday skills that they can apply in their lives to help them be happier, stronger, and healthier. Whatever situation you're in, therapy might be able to help you navigate your life and feel a little bit more resilient day to day. So talk to your physicians, family members, and other individuals who provide care and support in your life to see if therapy is right for you and what type of therapy might be the best fit.
Myth number 4. Have you ever heard the saying, everyone has a little OCD?
Yes, this is so common on social media. We hear people misusing terms like OCD, which stands for obsessive compulsive disorder, and bipolar disorder. A lot of times when people say, you're OCD, or we all have a little bit of OCD, they might be referring to the traits of liking things to be orderly and well organized, or potentially to being averse to germs, and in some cases having germophobia, again, a clinically impairing and distressing form of fear of germs. However, this doesn't capture the complexity of what obsessive compulsive disorder really is. We'll provide you with some resources so that you can hear from experts on what obsessive compulsive disorder really is and come to better understand individuals who experience this in their daily lives. Importantly, we shouldn't throw around mental health terms as a form of insulting somebody or judging somebody's character or behaviors, because we're all coming across a continuum of different symptoms and traits that we might experience in our daily life. And that's okay. That's what makes us all unique. And luckily for those who do find distress or impairment with symptoms of OCD and other diagnoses, again, there's help and there's support available to you. I'll also briefly mention, because I alluded to it, that we tend to throw around that term bipolar disorder a lot too, right? We might say this when someone is experiencing up or down mood states quite regularly, when in fact, people with bipolar disorder can experience prolonged periods of really severe depression or really severe mania. Their moods and behaviors don't fluctuate on a day-to-day basis. These can be longer spells of experiencing depression or mania, and again, they're clinically impairing. Some individuals with bipolar disorder may not experience these spells for long periods of time in between, and some individuals may only experience 1 or 2 manic episodes in their entire lives. Again, help is available for people who have these experiences. And again, we shouldn't use these terms in inappropriate ways. When we better shape our language surrounding mental health, we can break the stigma that comes with mental health disorders and provide better supports for those who need it. Thank you so much for dispelling those myths with me. Do you have questions about other possible myths in psychology that you've heard? Leave them in the comments below. Thanks so much for watching. Be sure to like and subscribe, and stay resilient.